things to do.
I seem to remember doing your laundry when I had other things to do.
Once. I only asked you once.
And driving you to work all those times.
I know.
And giving you all that lunch money, which I never asked you to repay. And of course, that story I told Stanley.
What story?
Okay.
Come on, guys. What's going on?
My niece, Margaret Ann, is coming up from Jamaica for a visit.
Oh, terrific.
Her little niece, a kid. She wants me to show her around the city. She thinks I'm a tour guide or something.
You'll do just fine.
Why does it have to be me?
And that time I told your bookie you were in Chicago.
Okay, you got me. One official escort at your service.
That's more like it.
Well, was I right about the Bartolino?
Absolutely. Beautiful nose, excellent finish. But there is still one unanswered question.
Go ahead.
Who are you?
I mean, you don't know me by now? Janet Weems from Akron, Ohio, daughter of an engineer. I thought we covered all that.
Who are you now? What do you do?
Oh, you mean what I do is what I am, right?
Probably.
Know me by my eyes, by my hands. Know me as the person who loves Bach and the Beatles and Rossini and Spumoni. People, passion, birdsong, sunsets. I'd say that's knowing me pretty well.
There is one other thing I'd like to know.
What's that?
You're gonna vanish again.
Like Cinderella? No. No, tonight is ours. If you want it to be.
I'd like that very much.
You better chug-a-lug that wine, fella. We've got miles to go before we sleep.
There, how's that, okay?
It'd be better if I had something more for the pain.
I'm sorry, but you had something less than an hour ago.
Well, it still hurts.
I'll talk to Dr. Gates about it, all right? In the meantime, is there anything else I can do for you?
You wouldn't happen to have a manicurist on the staff, would you?
No, but, I bet I could find you a nail file.
That's awfully sweet of you.
It's no problem.
Oh, Miss Brancusi, that patient, Miss Morley, how is she?
She's still in a lot of pain. We're trying to make her as comfortable as possible. Mr. Slocum, you're here awful late.
Well, I had some work to do. Do we know what's wrong with her yet?
No, not yet. Is she a friend?
Oh, no. I was just concerned, as I'm concerned about all our patients. Well, now, if you'll excuse me, please.
So.
Good morning, Trapper.
Oh, hi, Ernie. Janet, this is Ernestine Shoup. Meet Janet Weems.
Pleased to meet you.
So, listen, when am I going to see you again?
I'll call you.
Promise?
I gotta go.
Bye.
Seems nice, Trapper.
John.
Arnie.
John, I could use your advice on a delicate matter.
Shoot.
Well, speaking hypothetically, let's say there was a woman.
Uh-huh.
Truly remarkable woman, and you wanted to make her acquaintance. But there were some obstacles in the way.
Oh, what sort of obstacles?
Well, there's the matter of ages, and then she's extremely, well, difficult to approach.
How come?
Well, she's so beautiful and desirable.
Hey, come on, Arnie, let's stop dancing around it. Who is she?
Oh, it's not anyone in particular.
He's got the test results on Laura Morley. Hi, Ernie.
Morley, How is she? What's wrong with her, do you know?
No, not yet. She has hematuria, but there's nothing on the x-rays. She still has the flank and back pain.
Maybe we'll find something. Oh, by the way, Arnie, this is the guy you should talk to.
What about?
About your hypothetical problem.
No, I don't think so.
No. He is the hospital authority.
Sure I am. On what?
Matters of the heart. And here is a man who needs your expertise. Go on, Arnie. Tell him your story.
I was telling him about a hypothetical woman.
Very beautiful, desirable woman.
Oh, yeah? What's her name?
Well, come on, Arnie. The expert cannot work without the facts.
Laura Marley.
What do you say, expert?
Walk in and say hello and see what happens.
I can't do that, not without a formal introduction.
Arnie, that went out with the buggy whip.
No. It's still done in more civilized circles. And you are just the one to do it.
Me? Come on.
You are her doctor. Tell her that there is a gentleman on the staff who would like to meet her.
I'd appreciate it. Gates? Gonzo?
All right. It'll be weird, but all right.
See how easy it is? Anytime you need help, Arnie.
Looks like home.
Well, what's the topic for today? Cubes, cube steak, Rubik's Cube.
Your choice.
I'd like to know more about you.
I suppose your friend, Mrs. Shute, told you.
Told me about what?
You mean you don't know?
I'm all in the dark. Don't know about what?
Don't know about what I do, about my occupation?
No?
Well, what I do is, I'm a poet.
I knew it. I knew you were an artist of some kind.
My sensitive soul gave me away, right? Or am I just weird?
Why didn't you tell me this before?
I didn't know how you'd take it. I mean, that's a pretty flaky business, poetry.
Well, no, wait a minute. I think we need personal visions. A special way of looking at the world.
To see a world in a grain of sand, and heaven in a wildflower.
Hold infinity in the palm of your hand. Eternity for an hour.
Very good. Very good. Surgeon who quotes Blake. You amaze me every time I see you, Doctor.
You're not so bad yourself. You published?
Nope. Not yet. I'm working on it. But I do have a public reading coming up.
Oh, really? That's terrific. I'd love to hear you.
Well, it's a possibility. If I tell you where it is.
Miss Morley?
Hello, Doctor. I hope that's good news you're carrying.
Well, it is and it isn't. We found some obstruction in your IVP and your serum calcium is elevated.
Do I look all right to you?
You look fine.
Well, I think all this pain is giving me a wrinkle right here. It'll take a month of collagen facials to get it out. Oh, what's that mean?
Well, it means that you probably have a kidney stone, and that's what's causing all your pain.
Well, can you make the pain stop now that you know?
We'll try. We can give you more medication, but if you don't pass the stone, we may have to operate.
Operate? No. I'll pass it. I'll make myself pass it. That could be done, you know.
Possibly.
I'm telling you it can.
Well, I'm afraid that's not the end of it. Unless we find out what's causing the kidney stone, you may get more of them.
Oh, that sounds like more tests.
Mm-hmm. We'd like to get started right away.
This is turning my life upside down.